Hi, Eileen Veilleux The Fam here. Welcome to another installment in our mini mental health series. And in this installment, we are going to be covering hair pulling disorder. Before we begin, let me just remind you to watch the full video because in the video there'll be 3 keywords. When I get to the keyword, I will say keyword and then what that keyword is. At the end of the video, in the comment section, along with a genuine comment about the video, put in what the 3 keywords are to be eligible for my free merch giveaway when I reach 2,000 subscribers. So let's get started. What is hair pulling disorder? Well, hair pulling disorder is a mental disorder that involves keyword recurrent, irresistible urges to pull out hair from your scalp, eyebrows, or other areas of your body despite trying to stop. Hair pulling from the scalp often leaves patchy bad spots, which causes significant distress and can interfere with social or work functioning. People with hair pulling disorder may go to great lengths to disguise the loss of hair. For some people, hair pulling disorder may be mild and generally manageable. For others, the compulsive urge to pull hair is overwhelming. Some treatment options have helped many people reduce their hair pulling or stop entirely. So what are the signs and symptoms of hair pulling disorder? Well, some of the signs and symptoms of hair pulling disorder often include repeatedly pulling your hair out, typically from your scalp, eyebrows, or eyelashes, but sometimes from other body areas and sites. May vary from over time. An increase in sense of tension before pulling or when you try to resist pulling. A sense of pleasure or relief after the hair is pulled. Noticeable hair loss such as shortened hair, thinned or bald areas on the scalp or areas of your body, including sparse or missing eyelashes or eyebrows. Preference for specific types of hair, keyword rituals that accompany hair pulling or patterns of hair pulling. Biting, chewing, or eating pull-out hair. Playing with pulled out hair or rubbing it across your lips or face. Repeatedly trying to stop pulling out your hair or trying to do it less often with success. Significant distress or problems at work, school, or in social situations related to pulling out your hair. Many people who have hair pulling disorder also pick their skin, bite their nails, or chew their lips. Sometimes pulling hairs from pets or dolls or from materials such as clothes or blankets may also be a sign. Most people with hair pulling disorder pull their hair in private and generally try to hide the disorder from others. For people with hair pulling disorder, though, hair pulling can be focused. Some people pull their hair intentionally to relieve tension or distress. For example, pulling hair out to get relief from overwhelming urge to pull hair. Some people may develop elaborate rituals for pulling out hair, such as finding just the right hair or biting pulled hairs. Automatic. Some people pull their hair without even realizing they're doing it, such as when they're bored, reading, or watching TV. Now, the same person may do both focused and atomic hair pulling, depending on the situation and mood. Certain positions or rituals may trigger hair pulling, such as resting your head on your hand or brushing your hair. Hair pulling can be related to emotions also. Negative emotions for many people with hair pulling disorder. Hair pulling is a way of dealing with negative or uncomfortable feelings, such as stress, anxiety, tension, boredom, loneliness, fatigue, or frustration. Positive feelings. People with hair pulling disorder often find that pulling out hair is satisfying and provides a measure of relief. As a result, they continue to pull their hair to maintain these positive feelings. Now, hair pulling disorder is a long-term keyword chronic disorder. Without treatment, symptoms can vary in severity over time. For example, the normal changes of menstruation can worsen symptoms in women. For some people, if not treated, symptoms can come and go for weeks, months, or years at a time. Rarely, hair pulling ends with just a few years of starting. So that does not happen very often. It's very rare that once somebody starts pulling their hair out with this disorder that they're going to stop without treatment. So what are the causes of hair pulling disorder? Well, the cause of hair pulling disorder is unclear. But like many complex disorders, hair pulling disorder probably results from a combination of genetic and environmental factors. So knowing this, what are the risk factors in this disorder? Well, the risk factors tend to increase the risk of hair pulling disorder, which some are family history, which is genetics may play a role in development of hair pulling disorder, and the disorder may occur in those who have had a close relative with this disorder. Age. Well, hair pulling disorder usually develops just before or during the early teens, most often between the ages of 10 and 13, and it's often a lifelong problem. Infants can also be prone to hair pulling, but that is usually mild and goes away on its own without treatment. Other disorders. People who have hair pulling disorder may also have other disorders, such as depression, anxiety, or OCD. Stress. Severely stressful situations or events may trigger hair pulling disorder in some people. Although far more women than men are treated for hair pulling disorder, this may be because women are more likely to seek medical advice. In early childhood, boys and girls appear to be equally affected. So what this is basically saying is more females have reported it than the men. But we all know there's a lot of men out there that don't like doctors. They don't like hospitals. So they wait until things are basically on their deathbed. Where females are more apt that when we have warning signs or we don't feel something's right, we seek medical attention faster. Is there any complications to hair pulling disorder? Well, although it may not seem particularly serious, hair pulling disorder can have a major negative impact on your life. Complications can include emotional distress, where many people with hair pulling disorder report feeling shame, humiliation, and embarrassment. They may experience low self-esteem, depression, anxiety, and alcohol or street drug use because of their condition. It could cause problems with social and work functioning through embarrassment because of hair loss may lead to avoid social activities and job opportunities. People with hair pulling disorder may wear wigs, style their hair to disguise bald patches, or wear false eyelashes. Some people may avoid intimacy for fear that their condition will be discovered. Skin and hair damage. Constant hair pulling can cause scarring and other damage, including infections to the skin on your scalp or the specific area where hair is pulled, and can permanently affect hair growth. Hairballs. Now, that you don't normally hear with people. You hear about that with animals, but people also get hairballs. Hairballs. Eating your hair may lead to large matted hairball in your digestive tract over a period of years. The hairball can cause weight loss, vomiting, intestinal obstruction, and even death. So you can see it can be serious condition. It is a mental disorder. Um, you see cartoons with people, going like this, like what you see on the screen where they pull their hair. But what people don't realize is this is a real mental illness. There is a medical term for it, but it's a long word. That's why I did not use it. I just used what it means. So if you see somebody with a bald patch, don't judge them. Try to understand, try to help them. Talk to them, find out if they're stressed. Do what you can to help. But the first part of breaking the stigma to anything and bringing awareness to different situations is through education. And that's what these mini mental health series is about, is educating. Once you get educated on the different mental illnesses, then you can begin to start learning to see with your heart. But remember, there's much more to it than just being educated. After you're educated, if you have a family member, a loved one, a friend, or just an acquaintance that may fall in any of these categories that we have talked about in previous installments or even in this one, to remember, excuse me, we don't truly know what that person's going through in their life. We don't know what stresses they have, if they have any other type of mental disorders, but it doesn't mean that they're any less of a human being. We all deserve love, understanding, and compassion. That's what we were created for. And remember, words can hurt. They can help somebody or they can hurt somebody. Please don't be the person that hurts somebody. And the people that normally hurt somebody, we have a word called for that, and that's shallow, because they see this, and that's it. And they judge by that. Someone that's not shallow looks deep inside the person and sees inside. Looking at this picture, can you tell me what you see? I can tell you what I see, seeing from my heart. I see a girl that is really stressed and full of anxiety, probably feeling like nobody cares. Nobody wants to hear what her problems are. Nobody understands. She's probably feeling alone. And she's just at her wit's end. And by pulling that hair, it just relieves the tension. It's like a punching bag on your desk for people that have stress, or a stress ball. When you get stressed, squeezing that stress ball gets the anger out. Well, with people with hair pulling disorder, that doesn't work for them. The only thing that works for them is pulling hair. And some of them, like I said, gets bad where they'll eat their hair that they pull out. It causes many problems. And a lot of times it's because nobody really truly does understand what they're going through, and nobody wants to try to help. And this is how things happen. Please, out there, remember, everyone, see with the heart, not the eyes. The eyes, what we see here, this doesn't matter. What matters is here in the heart. What the eyes can't see is what counts. When you see from your heart to theirs, you can truly understand what they're going through. And from there, you can ask questions, and ask nicely. You don't have to sound like you're nosy. Let them know you care and you want to help. And, you want to be part of their life, even as a friend. Ask them, what can I do to help? How can I lessen your anxiety or your stress? Let me help you. That's what these series are, is to teach you how to see with your heart and not your eyes. As I said, the first step is education. The second step is getting involved. You getting involved in the beginning just by getting educated. Now, if you know somebody with this, bring it to the next step. Ask questions. Go to counseling with them. Encourage them. Be there for them. That's what matters, and that's what's going to make this world a better place. Remember, every time you're nice to somebody, you say something nice, and you see with your heart, you're not only helping that person, but you're helping yourself. Because what happens when you do that is you release powerful endorphins inside your own body that help to heal you both physically, mentally, emotionally, in every aspect of your life. Now, if you're negative, you're going to have negative effects on your body. That's going to release chemicals that's going to make you sick. You're going to feel sick all the time. You're not going to have a happy life. So it's much more beneficial to be on the good side of the coin than on the bad side. It's more beneficial not just for the person you're helping, but for yourself to see with your heart and not your eyes. So remember, until I see you all again, I'm looking at you out there. Yeah, you. I love you for who you are. You are uniquely made. And you matter just as much as anybody else does. Your life is important to me because you are important. So until I see you again, I love you all. Have a great day. Bye.